Hey guys, what's up? Okay, in today's video we will see a lot of things about blood loss. Blood loss is also called hemorrhage. Blood loss is in layman terms. We will learn the pathophysiology, the disease, the classification, the degree of it, the management of hemorrhage, the damage control, resuscitation, and a few more things about transfusion. So let's get started. Hemorrhage is broken into blood and loss. So hemorrhage means blood loss. The treatment is to arrest the bleeding, not anything else. So the caution here is that we are not supposed to give blood transfusion or saline and stuff resuscitation, because these two things will cause dilution of the coagulation factors, which we do not want because that will worsen the hemorrhage. Also, metabolic acidosis, hypothermia occur following normal saline infusion, which is having a very low pH by itself, like 6.7 is the pH of normal saline, and plus the blood is cold, which causes hypothermia. Pathophysiology, well, it starts with trauma, shock. Well, it's a bit hard. So what to do now? Okay, I've simplified this. So there's hemorrhage, which occurs following trauma. Trauma is going to lead to hemorrhage, which leads to shock. Shock is going to cause metabolic acidosis, hypothermia, and blood loss. Blood loss is leading to shock, which is why we are treating the hemorrhage by giving transfusion. Transfusion, however, is a double-edged sword, because transfusion technically will replace the blood which is lost, but ultimately it's going to cause dilution of the coagulation factors, which result in trauma-induced coagulopathy or acute traumatic coagulopathy. Plus, we already know the normal saline is going to be having low pH, which is causing acidosis, and the blood is cool, which causes hypothermia by itself. The fact is that there are a few definitions we need to learn. The definitions for hemorrhage: if it's a really revealed or a concealed hemorrhage. Revealed hemorrhage suggests there is an obvious or an external injury, external hemorrhage, whereas concealed means it is contained within a body cavity. It's usually due to a long bone fracture. Then a hemorrhage could be primary, reactionary, and secondary. Primary hemorrhage occurs immediately following an injury. It is due to the injury. Reactionary occurs within 24 hours, and secondary occurs somewhere after 7 to 14 days. So the primary hemorrhage is due to injury. The reactionary is due to clot getting dislodged due to vasodilation, or a secondary hemorrhage occurs due to vascular sloughing following necrosis, pressure necrosis of the blood vessels, or malignancy. Moving on to the other classification, which is surgical and non-surgical. Surgical is due to surgery, non-surgical is due to coagulopathy. Surgical can be corrected by angioembolization. Non-surgical can be temporarily corrected by packing, but correction of coagulopathy is necessary. There are certain degrees in the classification of the hemorrhage. A relatively good system of classification is the traditional system of classification of hemorrhagic shock, which is based on the ability of the person to compensate for that much amount of volume lost, meaning the compensation is directly proportional to the volume which is lost. So so there are four classes: 1, 2, 3, and 4, based on the percentage of blood lost, which is less than 15%, 15 to 30, 30 to 40, and more than 40%. However, there are a few pitfalls in that compensating mechanisms are not the same for all people, because a muscular person is compensating better than an obese person. A young one is going to compensate better than an old one, which is why we have a good system of classification based on which treatment decision can be done. So the good system has we take into consideration the vitals, the base deficit, and the preload, but most importantly the dynamic fluid response to fluid therapy. Well, check out my previous video on the same topic. Well, the topic was shock. Treatment of hemorrhage is that we have to identify the site of bleeding and apply direct pressure, ensuring that the airway and breathing are normal. And after that, we have to ensure a large IV. After cross matching, we need to ensure blood transfusion, and then identify the perfect site and do whatever is necessary to control the bleeding by a rapid bedside test, and then we control the bleeding. So there's this protocol which is called the damage control surgery, which has 4 steps: arrest the bleeding, control the sepsis, further bleeding has to be stopped, and nothing else has to be done. Damage control resuscitation protocol says that there should be acute traumatic coagulopathy, which has to be anticipated, and the blood pressure should be considerably low but not very less, as in life-threatening less, and dilution has to be prevented, and DCS, that is the damage control surgery, has also to be ensured. And moving on to blood transfusion, which is we can transfuse a lot of stuff like blood and blood products. Before transfusing, the blood products are screened for diseases like HIV, hepatitis, and syphilis, malaria, filaria also. WBCs are removed to prevent immune reactions. Well, this is the cutoff, 450 ml per for 3 times per year is the maximum amount a person can donate in the US. So, whole blood packed RBC is free, fresh frozen plasma, cryoprecipitate, platelets, PT complex, and autologous blood transfusions are very common. So, whole blood is very good, but then it's a very important resource. Because of the following advantages. The whole blood has a lot of coagulation factors and it is metabolically active. Packed RBCs are having hematocrit of 50 to 70 percentage and it is stored for a period of 5 weeks in SAGM medium at a temperature of 2 to 6 degrees Celsius. Fresh frozen plasma, the shelf life is 2 years and it is stored for at minus 40 to minus 50 degrees Celsius. Cryoprecipitate is stored at an even lesser temperature, that is minus 30 degrees Celsius, with the same shelf life of 2 years. Essentially, it is a supernatant of the fresh frozen plasma, rich only in fibrinogen and factor numbers 8. Platelets are stored only for a period of 5 days, approximately equal to the AC temperature, 20 to 24 degrees Celsius. But the special point is that platelets are stored in an agitator. PT complexes, that is prothrombin complexes, the 2, 7, 9, and 10 factors are very essential. They are derived from pooled plasma. Autologous blood transfusion, meaning before elective surgery, the person who is undergoing the surgery can save his or her own blood 3 weeks prior to the surgery using a self-saver, which is filtering only the RBC and taking it out. So this is a small mnemonic ABC, autologous blood and blood products and cryo. What are the indications of blood transfusion? There are some indications as in blood loss and anemia. Acute blood loss is a very good indication. Anemia, perioperative anemia, and symptomatic chronic anemia. Periop criteria for blood transfusion, that is based on the hemoglobin percentage. So if it is less than 6, we decide that probably the person is getting benefited using blood transfusion, and if it is between 6 and 8, the person is unlikely to get any benefit from blood transfusion unless there is a bleeding or there is a surgery which is planned. And if it is more than 8, there is no indication for blood transfusion if there are no risk factors. Blood grouping and cross-matching, as we already know, ABO and RH groups antigenically strong, but only majorly occurring antibodies are ABO, but however RH can also be induced. ABO is based on the carbohydrate residue on the glycoprotein attached to the RBCs. Transfusion reaction are of 3 types: the usual, the severe, and the febrile ones. The usual one is called an acute hemolytic one. Severe one causes intravascular hemolysis and multi-organ failure, which means at least 2 organs are failed. Febrile is often associated with the GVHD or the graft versus host disease, which is often seen with fever and chills. So this is the cross-matching, the major and the minor cross-matching. So in the major cross-matching, the recipient serum and the donor cells are cross-matched and checked for antigen-antibody reactions as seen over here. But however, this method is going to take at least 45 minutes, which is why during emergency, this is not the best method to do a cross-matching, which is why you have a thing called universal donor. Universal donor is universal and it's the blood group O. But however, there are 2 groups which are O plus and O minus, which is O positive and negative. The positive ones are usually given to the male and negative ones are given to the women because women bear children. We don't want antibodies to be produced against this O, which is why we give O negative to women. Complications following a single or a massive blood transfusion. Single transfusion will lead to incompatible blood transfusion, febrile reactions, which we already saw, allergy, infection in addition. And also air embolus as shown in this picture, thrombus as seen here, and this lung denotes TRALI. TRALI is transfusion associated acute lung injury or transfusion related acute lung injury, which is very common with FFPs or the fresh frozen plasma. Massive blood transfusion can deplete coagulation factors, calcium, potassium, reduces the temperature causing hypothermia, but however it can cause hyperkalemia and iron overload. Iron overload is called hemochromatosis. All right, so about the treatment of coagulopathy, we have to anticipate it. We need to see, we need to forelook it. I mean, we can never forelook it. We need to anticipate the coagulopathy. And once coagulopathy has happened, we have to give 1:1:1 ratio of RBC, fresh frozen plasma, and the platelets. And testing often is essential, testing for clotting factors and the prothrombin time, the bleeding time, etc. And treat using tranexamic acid. Blood substitutes, this is the update and the last slide for today. So biomimetics and abiotic factors are the new blood substitutes. Biomimetics are associated with hemoglobin, which means they're hemoglobin based, and abiotic are perfluorocarbon based. These are, however, under trials, but however, they are showing promising results. Well, see you again, guys. Read, Bailey, and love.